Hello and welcome everyone with me and Dr. Mohan. So we are talking about prostate enlargement. Why does prostate enlargement happen in men?
It's a very interesting topic because a common question I get is why does prostate enlarge only in the male and not the female? The reason is the male hormone testosterone, which makes a boy into a man, giving us mustache and strength, is also the hormone that stimulates the prostate to enlarge throughout a man's life. Unlike the woman, there is no distinct andropause. In the case of the woman, estrogen secretion stops, there is menopause, and the hormone secretion ends. In the male, till the last breath, testosterone is secreted, and because of that, the prostate continues to enlarge. Inshallah, the length of life will determine the size of the prostate. The older you become, the prostate is going to become big in every man. So the enlargement of prostate becomes a problem age greater than 45 in all men on the planet.
And what are the symptoms of prostate enlargement?
The male human being and the male dog suffer from prostate enlargement. The symptoms are very common. Difficulty in passing urine, going to the bathroom frequently, especially at night with disturbed sleep, urinary tract infection because the urine that is not come out stays back in the bladder and causes urinary tract infection, blood in the urine, painful urination, and the inability to hold urine. So once it comes to the mind, you have to urgently go to the bathroom, a symptom we call urgency. So in general, difficulty, frequency, urgency with respect to urine are the common symptoms of prostate enlargement.
How do you evaluate prostate enlargement?
The first and foremost thing when a gentleman presents with these symptoms is to investigate in three parts. Number one, we do what is called a detailed history of the act of passing urine. How many times do you go? Can you hold urine before you reach the bathroom? Do you leak? Do you pass urine with force, or do you do to pass urine, strain to pass urine? So a good detailed history. The next thing is a very simple test called uroflowmetry, where we ask the patient to drink plenty of water, hold his urine and pass urine into a commode. There is a laser beam that is cut, and it measures the speed at which you pass urine, and we know whether the speed is appropriate to age or lower than the expected volume. Then the most important test is an ultrasound, where we find out the size of the prostate, how big is it, it has got 3 lobes or 2 lobes, and how much of the urine is staying back in the bladder after they pass urine, which is called as post-void residual urine. And last and extremely important test is a blood test called PSA. If it is less than 4, it is age appropriate. It's Allah's mercy on a long life. That it is a normal enlargement of the prostate, an age appropriate enlargement of the prostate. If it is more than 4, the possibility of cancer has to be considered. So using a combination of a good history, a uroflowmetry, an ultrasound and a PSA, we will be able to come to a conclusion. After that, we do something called a digital rectal examination, putting a finger in the macanal carouge and examining the prostate.
How do you treat age-related prostate enlargement?
Now, if the gentleman has minimum symptoms, is around 40, 45 years age, below 50 years, oral medication is the treatment of choice as long as we know the PSA is below 4. If the gentleman is age greater than 50 and has problems because of prostate obstruction, repeated urinary tract infection, blood in the urine, or the kidney is not working properly because of obstruction, or the need to get up in the night disturbs sleep so much that he can't function as a normal human being, then the need to intervene comes up. The way to treat enlarged prostate is an endoscopic procedure using laser energy. We call it as TURP, or transurethral resection of prostate. We put an endoscope through the normal passage where urine is passed in the reverse direction, and we use laser or bipolar energy to vaporize or remove pieces of enlarged prostate. If the prostate is very big, we can cut pieces of the prostate and push it into the bladder and use a mixer-like device. We call it morcellator to morcellate, make small water-based tissue mixture of the prostate and suck it out. or if it is even bigger, we can use a device like the robot to remove the prostate and put it into a bag and bring it out. So depending on the size of the prostate, depending on the age of the patient, a variety of techniques can be used to remove age appropriate prostate enlargement once we are sure that there is no element of cancer in this enlarged prostate.
How do you manage prostate cancer?
Is a very important question. The age of the lifespan of human beings, including in the Sultanate and in general across the world, is increasing. As the age male human being lives longer, the possibility of cancer prostate increases. So it's very important that in men age greater than 40, at least to do PSA once a year. I always tell them that the best birthday gift you can give your brother or your father or a loved one, your husband, is to get a PSA done on their birthday. If the PSA is high, then we give a course of antibiotics, because the reason for increase in PSA other than cancer is prostatitis, infection of the prostate. So after a course of antibiotics, if the PSA does not come below 4, then we need to do a biopsy of the prostate. It is done by putting an ultrasound probe into the carouse, and through that a biopsy is done. It can be done on an outpatient basis. Once the biopsy is done, we grade the prostate as mild, moderate and severe. It is called Gleason grading. And we also use a test such as a MRI or a PSMA PET scan to be sure that the cancer is only in the prostate, organ confined or elsewhere. Occasionally, unfortunately, the patient may have cancer outside the prostate into the bone or other tissue. In patients with organ confined prostate, removal of the prostate, radical prostatectomy, nerve sparing radical prostatectomy is the technique of choice. In those who have cancer outside the prostate, it has gone to the bone or other tissue in the jism, in the body, then in those patients we will need to use an anti-hormonal treatment. As I mentioned earlier, testosterone hormone needs to be blocked. That is a korak, that is the food for the cancer cell. There are a variety of techniques in blocking the cancer cell. So a combination of medication or radiotherapy or chemotherapy may be necessary for advanced cancer prostate. For organ confined, that is cancer confined only to the prostate, radical surgery, especially nerve sparing robotic technique, would be the treatment of choice.
So thank you, doctor, for this wealthy information, and we just learned something new again.